Hey everyone, and welcome. Today we're diving deep into something called FHIR. Now, this is the key, the absolute key to unlocking one of the most important and, frankly, most locked down sets of data in our lives, our own health information. So let's start with a really simple and, let's be honest, super frustrating question. How is it that in an age where everything is connected, your health data is so often trapped? You know the drill, right? You get a lab result from one place, an x-ray from another, and it feels like none of these systems speak the same language. Well, that is the exact problem we're going to unpack today. So, here's how we're going to break it all down. First, we'll tackle that core problem, the data silos. Then we'll look at the original blueprint that was created to try and solve it. After that, we'll introduce the star of the show, the modern language of FHIR. We'll see how that's kicking off a whole app revolution, check out its impact in the real world, and then we'll look ahead to the future of our data.
Okay, so here's the fundamental challenge. Different hospitals, clinics, and labs all built their own digital systems over the years. You can think of them as all speaking completely different dialects. So without some kind of common language, sharing your information, seamlessly and securely, is next to impossible. Your data is basically trapped in these digital silos.
So to fix this, the industry knew it first had to agree on the basic rules of the road. I'm not talking about a specific language yet, but more like a conceptual blueprint for any piece of health information. And this is where something called the Reference Information Model, or RIM, comes into the picture. Now, what's really crucial to understand here is that RIM isn't something a developer can just start coding with. It's super abstract. Think of it less like a language and more like the universal rules of grammar. It's the thing that defines the core building blocks, the nouns, the verbs, the relationships that any health data language would have to follow to make any sense. To make this a little more concrete, let's take a simple doctor's visit for a patient we'll call Mr. Sinha. The RIM breaks it down like this. First, Mr. Sinha is an entity, a person. His function here is the role of patient. The visit itself, that's an act, a consultation. And the relationship that ties it all together is participation. See? Mr. Sinha participates in the consultation. Those four concepts are the foundation for absolutely everything else.
But, a universal blueprint is just too general for specific jobs. You need a detailed plan. That's where something called an RMIM comes in, a refined message information model. So if RIM is the universal blueprint for any building, you can think of an RMIM as the specific architectural plan for, say, a two-bedroom house. It takes RIM's abstract ideas and tailors them for one specific use case, like a lab result or a prescription.
Okay, so we've got the grammar, and we've got these specific plans, but we still need an actual modern language that developers can really sink their teeth into. And this is where FHIR finally enters the story, turning all of this theory into actual code. So this is the breakthrough. FHIR, which stands for Fast Healthcare Interoperability Resources, takes all that foundational modeling from RIM and RMIM and translates it into a simple, web-friendly format that the modern internet is built on. We're talking about things like JSON. It's the bridge that connects decades of theory to practical, usable code that developers can work with today. And this shows you exactly what that looks like. This is a breakdown of what's called a FHIR patient resource. Just look at how clean and organized that is. You've got a section for identity, another for formal IDs like a medical record number, and a really clear section for demographics like name and birth date. This is the standardized structure that finally allows all those different systems to understand each other. Right, so with a common language now in place, the door just swings wide open for something truly revolutionary, a world of third-party health apps that can securely plug right into your official medical record. This revolution is being powered by something called Smart on FHIR, and the analogy here is just perfect. It's basically the app store for your healthcare data. Smart handles the security and the login part, while FHIR provides the actual data language. You put them together, and you get a standardized, secure way for apps to connect to your records. And here's how simple it actually is. First, you launch an app on your phone. It uses Smart to connect to your hospital's system. Then you log in with your hospital username and password using a super secure standard called OAuth 2.0, and you grant the app permission. From there, the app can securely ask for your data, which gets delivered in that universal FHIR format. And if you're thinking this is some niche, futuristic technology, think again. It is already everywhere. Apple Health uses it to pull in your hospital records.
All the big electronic health record companies, Epic, Cerner, Allscripts, they all have entire app ecosystems built on this exact same standard.
But the impact of FHIR goes way beyond just the apps on your phone. It's actually becoming the backbone for transforming entire national healthcare systems all around the globe. Take a look at this number, 72. In the United States, a new rule is using FHIR APIs to completely change the painfully slow prior authorization process. Starting in 2026, insurance companies will have to make decisions on urgent requests within 72 hours. That is a direct, real-world benefit for patients. Faster access to care, all made possible by FHIR. And this is happening everywhere. The US is using it to connect payers and providers, the UK is building national personal health records on FHIR, and India has made it the foundation of its massive National Digital Health Mission, known as ABDM. And this just brilliantly illustrates the potential. This is a real command that a doctor can actually use in India today. Suki, show me the medications of Mr. Sinha. Because all the data is in a standard FHIR format, a voice assistant can securely pull up that info instantly. I mean, it sounds like science fiction, but it's happening right now. So with this universal language now firmly taking root, what does the future hold? What actually becomes possible when all of our health data can finally be understood by any system, anywhere? Well, the possibilities are just immense. We can start integrating social data to get a much fuller picture of a person's health. We can do large-scale secure analytics to spot public health trends. Medical researchers can get access to huge anonymized data sets to speed up discoveries. And maybe most important of all, it creates the solid foundation we need for trustworthy and effective AI in medicine. So let's end with this thought. For the very first time, all of our health data is finally starting to speak a single universal language. The silos are coming down. The question is no longer if our data can be understood, but what we're going to build with that understanding. Your data's ready, but is